So first thing I would like to know before I do the presentation, that I'll talk about 45 minutes or 1 hour, depends on the rhythm and all that. And then we will have question answers. So we should be done in 1.5 hours. But if it takes time, I don't have problem. I've switched off my phone. So I'm good. So most important thing, first let's talk about the tough decisions which you think are tough decisions, because I have not written them down here, but I will touch on them while talking. So Donna, would you like to say what is a tough decision in your experience?
Well, the tough decision for me was when I had called hospice for my grandmother.
Mm-hmm.
That was tough.
Yeah.
I'm concerned about her safety.
Safety?
Nutrition.
Nutrition. You already made some tough decisions.
We had to make a tough decision about hospice, whether to bring them in or not. We didn't know he was so close to death. It
Mm-hmm.
was sort of a shock to us. So we made the right decision. We decided to get hospice in. I don't know what we would have done without them those last.
Yeah, calling in hospice is an extremely tough decision.
It is.
Was when to go to the nursing home.
When to go to nursing home.
My mom is in a nursing home, and I think it's going to be hard to determine feeding to prolonging life and that type of thing.
Prolonging life.
I'm just starting to this, so currently how much do we let her do and how much do we need to take over for her?
For medicines, when to, kind of like they said, when to know when enough is enough, and to
Yeah.
We're together, let her talk.
My brother, thank you. I don't know, safety and like she said, when to know when to step in or how much to let her be, I don't know.
Yeah.
It's terrible.
So these two girls are here too. They are with time savers.
We are learning. We work with a lot of families that need help with the process of bringing in-home care, whether it's time, whether mom is agreeable, what the alternatives are, assisted living. So every piece of information we can get to share with people.
Gwen.
Nutrition is a big thing. My mother just turned 89 this week, and she says she's not hungry. She doesn't want to eat, So I'm just trying to figure out when to do what.
Financial issues has been a big issue here lately with my father. With my biological father, who I'm not in the home with, I'm worried because he thinks he might have Alzheimer's. So I'm not necessarily the caregiver of him, but I do want to know.
You are a consultant in the care.
Yes. Yes. So.
Martha?
I'm currently dealing with my mother. She's 89, and our tough decisions are when do we take over and we decide instead of letting her decide this is what you need to do. Do you need to stay in your apartment? Do you need to go to assisted living? How do we decide? When do we decide? And what just making that decision.
Yeah. So most of our problem that parents don't listen to you guys. Did you ever listen to them when they were you guys were young? So most important thing. So yeah. First thing we have to learn for any situation in life, to be very frank, if you see me 2 years ago, I used to get angry at everything, like, what the heck, how can this be done like this? Why this patient is angry? I gave everything to her. She should not be angry, things like that. So now I start thinking from the patient's perspective, like I still get angry at my wife and she gets angry at me, So there we don't have empathy. We are equal partners in not having empathy. But most important thing as a caregiver or as a loved one, we should understand is their perspective. So empathy is putting ourselves in their shoes and understanding from their perspective. Like if we are concerned about our father or mother, mom doesn't listen because mom thinks she's mom, she's the one who changed our diapers. She's the one who taught us how to hold the fork. She taught us everything, and now she still thinks she's mom. She still thinks she is mom. She should be the boss. And all of a sudden, we are bossing her around. You cannot sit there. You cannot turn on the stove. You have to turn off the television before going to sleep. You cannot turn off all the lights. We are bossing around. Small things, big things, we boss around a lot. As the parents get older, all of a sudden we start thinking that we should be the boss. They should be listening to us. And they have their own mentality. They want to be independent. So the most important thing is when you see a pushback from them, instead of pushing harder, pushing harder will make them depressed. Let's not push harder. Let's step back. Sometime for a minute, sometime for a few hours, sometime for a day or 2 days. Understand their perspective. And then think, how can we resolve this? Or ask them, what would they like to do? How would they like this to be solved? Ask them, how are you feeling? So a couple of questions like, how are you feeling? What kind of day you are having? Sometimes we don't ask them, no. Mom, you didn't, let me clean this, let me clean that, let me finish this off, let me cook the food for you, let me warm the food for you, let me do the dishes. And all of a sudden mom is at her home, but she feels a prisoner in her own home. So she should still feel that she's in command. She's still being listened to. The most important thing we should be doing is to listening to them. Because the more we listen, it's just like kids. When you listen to kids, they listen back. Similarly, when you listen to parents, they listen back. And especially if you have been good kid throughout your life, I've seen if you have been bad kid and all of a sudden you start bossing around, mom is not going to listen to you. But if you have been a good kid, she will listen. She will understand, but slowly. Let's not, if they are pushing back, don't push them hard. Push back hard, Slowly, step back. Think from their perspective. What would you like to do if when you are 89-year-old and your child is telling you, Mom, sit down there. You cannot get up from there till I come back from the kitchen. Things like that. What would you like to do? Would you like to be bossed around? Like I have one 17-year-old and one 20-year-old. Both of them don't listen to me. And they give me ideas on my Facebook and my LinkedIn all the time, and I don't listen to them either, So this mutual understanding or misunderstanding between us is going to grow. And there will be time then when they will say, Dad doesn't listen to us. But when was the last time he listened to us anyway? Same way. It will continue. So, but all of a sudden, because they are too frail, they are too elderly, they should be listening to us. We have to understand their perspective first. Let's understand their perspective. What would we like to do if when we are that old and that frail? So slowly they will listen, but first we have to listen for them to listen, you know. So what problems they have, it is all about them, you know, their strengths and their weaknesses. But again, we have to, there will be days when we will have to step forward, really, like calling in hospice, you know. That is a tough decision. That sometime you have to make decision because mom will not be able to make that decision, you know. Those decisions will be tough and we will talk about them. But again, be empathetic, have empathy, listen, put yourself in their shoes. Once we do that, I think many of you, you know, have kids, you know, so you can relate to it. You can relate both ways, you know. Mom doesn't listen, but I don't listen to my kids too. You know, your kids also might be saying, mom doesn't listen, what's the point of calling her? You know, she won't listen anyway. So it's all, the world doesn't listen to each other. We all have listening problem. But as far as elderly concerned, first we listen, then they will listen. So again, you know, I talked about that most of the elderly parents want to be independent. So what time we have to literally, you know, now she cannot do it. At that time, we have to step in. That time, that is a hard decision. Before that, it may not be that hard. You know, when they are completely capable of doing things, it may not be hard. But when you see they are incapable of doing things, then you have to, we will talk about that. So what are the things we should be looking into? So yeah.
Don't know why it's not to work.
I just hired her for free.
There we go.
So, you know, she works here, Brescia. So there are four conditions. We will go deep into those. Like, what is mental condition of the parent? What is the physical condition, health condition, and condition of the person taking care of them, you know. Like, I'm myself 70-year-old, mom is 89, but I'm 71 too. So I cannot lift mom. That is, you know, we will talk about that. That happens a lot. I see it in nursing homes a lot. So mental condition. So there are conditions which are curable, treatable, and there are mental conditions which are not curable. They are treatable, but they are not curable. So what are the curable conditions? Curable conditions are depression and anxiety. Parents with age, they get depressed sometime, and sometimes they have a lot of anxiety. I'll give you an example. I have a patient, he's 70-year-old. He was brought in by his daughter and wife because he was shaking too bad and not all the time. You know, so somebody diagnosed him with Parkinson's and he was started on Parkinson's medicine, but he will like do like this all of a sudden. And when he stands up, when you see it, he will go like this and then stop. So after discussing with him, I figured out that he has more of an anxiety issue. He does not have real neurological problem going on. So just to be on the safe side, I still called my neurologist friend and told him to see. But we gave him anti-anxiety medicine. He was perfectly fine. Now he takes care of his mother-in-law at home. He and his wife take care of the mother-in-law. I mean, both of them are now elderly, but the mother-in-law is at home and they take care of it. So anxiety is treatable. Depression is very common in elderly population, very common, because they are getting socially aloof, especially after 80. They are not going out, they are staying at home mostly. So their social life now is still, many of them have Facebook and Instagram, they see the grandkids and all that. But to be very frank, that is also making many people depressed, because oh, this guy is having a lot of fun, I am not having fun. But you only put good pictures on the social media. You never, there are few people who put their crying pictures also, but nobody follows them. Then you start this, don't follow this guy. But we only see the good part of it. What happens is, man, everybody else is happy, I'm the only sad one. And especially if you are at home, you get more depressed. So see this thing, if there is depression element, talk to the doctor. If there is anxiety going on, talk to the doctor. Can it be because it's a very treatable thing, and if they don't have any other health issues, depression and anxiety is treatable, and that can help the parent. So other thing is dementia. So dementia is a progressive illness. Many people think it is just a illness where you lose memory. But it is not just memory thing. Your body starts decaying basically. It is a brain disorder where the body also starts decaying. You lose your functional capacity, you lose your judgment, you lose your insight, you do not know whether you are going or coming. So how bad is the dementia? If somebody is dealing with dementia, the most important thing is, are they able to recognize their relatives, their children? Are they able to recognize you? The most important thing is, mom able to recognize me? She is living at home, and all of a sudden you notice she does not recognize you. Then it comes as safety. Now, is it safe for mom to be at home? What do you guys think? If the mom doesn't recognize you, she doesn't recognize anybody else, then this is a big safety issue. Although I think a parent can be treated at home as much as possible, but again, then it becomes such a big safety issue. Then they will be better off where there is help 24/7. If you can provide help at home 24/7, that is perfect. There is nothing wrong in that. Like sometime I have some 85-year-old, 86-year-old patient, they have 11 kids, So kids can rotate all the time, So somebody is there with them all the time. Somebody is sleeping, somebody at night, and the kids have so many friends and so many nieces, nephews, everybody coming in and going out. So that is not a big deal when that is happening. But some of them have 2 children, and they are losing the mind. And the child also has other responsibilities, they have their kids and grandkids and jobs. So many people have jobs and they cannot leave jobs, so they have to be at the job. Mother is alone at home and she doesn't know when to turn off the stove. It becomes a big safety hazard. Like I tell everybody to get this button, life alert button. So life alert button, what it does, it helps you call emergency right away. So all the elderly people above 75 should have it, because you never know when you are going to have a fall and you will not be able to reach the phone. So it is very important to have that life alert button. I believe in that. It has saved lives. Just this Thursday I was talking to an elderly lady. I told her, I think you should get life alert. She said, my daughter lives across the street from me. I said, okay, that's good. But still you should get life alert. Then she's 85, she shows me her new Apple Watch. This thing, you can call emergency, this as SOS, and you can call SOS through this. I said, wow, 85-year-old using Apple Watch, you know. That's called use of technology, you know. So give them, this safety feature should be there. If they are mentally good, they all should have this safety feature at home, life alert or calling help, you know. Because I don't know why most of the elderly people, even not taking a bath, they fall in the bathroom. And bathrooms don't have any phones, you know. Like, I don't know, you guys may have heard stories, but I have seen so many patients falling in the bathroom and staying there for 2 hours, 5 hours, 12 hours, 18 hours. You know, when somebody from Arizona, their daughter lives in Arizona, she's calling like, mom is not picking, then she calls a neighbor, neighbor is at work, finally gets out of work, goes and sees mom, and mom is finally found in bathroom after 18 hours. So safety, that is small feature, this button can help you call ambulance. You know, at least from the safety perspective, that thing, if they are mentally alert. But if they are getting demented, and there are many tough decisions in dementia patients. Somebody told me that my toughest decision was to take away guns from my father because he loved his guns, and the guns, he's very unsafe then, you know. So you have to take them away. Father will, you know, maybe 1 day or 2 days he will recognize that, but then he will forget because he is having dementia. But again, that type of person, when the dementia is very bad, they need 24/7 care. If you are financially stable and physically stable to provide that care, that's great, you know. But if you are not, then it is better for them to be in nursing home. That is a tough decision to make, but you have to make it at that time. You know, not like, okay, mom cannot do this, a couple of calculation problems, no. But when it is becoming that bad that they are not recognizing you, then when they cannot do calculation, they go to grocery store and they don't know how to calculate anything, you know. Okay, so they took out a wallet from their pocket, but they don't know how to give money. You know, they drive to this store, grocery store, but all of a sudden while coming back they lose the direction. That is the time to take away the driving license from them. You know, I have a favorite story about driving license. You know, all the 90-year-olds, I don't know why, but their name is Mary. So almost everybody. So Mary, one of those Marys, she's 94. I remember it was about 10 years ago, or a little less than that. She came to my office, and Dr. Moolani, she was angry, always pleasant. You know, 90-year-olds usually are pleasant. I don't know why. They are very pleasant. That's why they are living to 90, you know. So she was very angry that day. I said, Mary, what's going on? You are never angry. Why you are angry today? Would you believe they took my driving license away? I was like, thank God. You know, she was like, Dr. Moolani, what did you say? You know, so I said, no, I was thinking about something else. You carry on. You know, so driving license, you have to, at that time, you know, because like we see this teenagers causing accidents, but accident rate is very high in elderly people also, at 80 and above. It is extremely high. So you cannot make the decision, okay, let's go and take a, but you can do it politically correct way, call a cop and, you know, or people who are driving people, like the mom cannot drive. How can you take away the license? So you say, look, I have nothing to do with it, you know. You can say that. But again, what you are doing? For the safety of mom, that is very important, you know. Nothing, you can play like, you know, I have nothing to do with your guns or driving or anything. I want you to have everything, you know. But you have to do that. I mean, when they are very some, I mean, parents know us also. They know what the heck we are doing, I still think children know parents better than, especially, 5-year-old can figure out when dad's mood is bad and when is good, when to ask for ice cream and not to ask for ice cream, So, but when they become adult, they know that we are we are the one who are doing this, but this is a tough decision we have to make. When to make that decision? When you can clearly see, like driving is not safe for them, especially after 90. It increases the risk of, look, I am perfect. I mean, I hear it, from a lot of patients. I was driving since your grandfather was born. I know that, I know. I used to argue with 90-year-olds also. I don't argue, I agree with you. So, I tell the daughter, usually daughters come, I don't know, sons are not maybe the parents don't listen to sons. What do you think, They still listen to daughters more than sons. My mother listens to me. My father doesn't listen to anybody in the world. So parents always have one favorite child also. Or some bully child who can get the things done. Isn't that true? Are you one of them? No, you're not?
Got 5 siblings, so no, she knows who that is.
Yeah, like some bully child, he or she can get things done. Mom, I told you do this. Okay, no. There are kids like that, isn't it? They listen to that kid. Somehow, my wife is that kid. I'm not kidding. She calls her dad, I told you to do that. Why didn't you do that? I tell her, hey, who are you talking to? My dad. Okay. I'm nothing to do with it. I just get out of the room. But you all know that one bully child or one favorite child, they listen to that child. Then talk to that child and get the things done which you think are important, So very important to take away the licenses and guns when they are not mentally capable. So dementia, you have to see what stage of dementia is that. We'll talk more. So let's go. No, click this button.
That's the one I clicked first. There we go.
Is it? I don't know. It works only when I click it. So we talked about judgment. How good is their judgment? So, now, I don't know how many this applies to, but this applies to a lot of dementia patients, that their behavior gets very bad sometimes, not all the time. Most of them are very pleasant, but some of them become psychotic. They start throwing things, they start using the bad words which they have never used. Children are embarrassed. Look, my dad, he never said anything bad in his life, and all of a sudden he's foul-mouthed, all of a sudden. So, like children are embarrassed, all the relatives are embarrassed who are coming, and that time there are some medicines we can do, but like antipsychotics, when they become psychotic, when they are hitting, when they are throwing things. Antipsychotics, there is a bad thing about antipsychotics in dementia patients. Antipsychotics cause life expectancy to decrease. The life expectancy decreases with antipsychotics. But now again, the thing is that, do you want them to continue to behave like that? Or you want them to have a good life, good quality of life? That's very important, Do we want them?
It doesn't matter what kind of dementia the patient has.
No, doesn't matter what kind of dementia, but all the dementia people can have.
Demented is demented. Is that correct? Is that what you're saying?
No. I'm talking about behaviors and dementia. Some of the patients can have behavior problems, not all of them.
That's what my mother was experiencing.
Behavior problems?
Little meltdowns, and I thought her and I were going to have have a throwdown in the Walker store this afternoon, she has fits, throws little fits. She doesn't get her way or thinks you're talking too much for her. She can't even talk half the time. You don't even know what she's saying.
Does she know you?
Oh yeah.
Okay.
But she's.
Maybe she might have depression also.
I guarantee it. She sits and cries.
Yeah.
And she's okay, and then she's a mess.
Yeah, so it sometimes it is not a cookie cutter thing like psychosis is there. Sometimes it might be depression. So in psychosis, they are completely out of it. They have no clue. They are angry. They are mad. They are throwing things. Like I see it a lot in nursing home. They will grab hold of CNA and yank her arm and things like that.
Borderline, where I thought she was a little out of control.
Yeah, so the doctors can help in that, but again, whether she needs dementia medicine, whether she needs psychosis medicine or depression medicine, that has to be discussed with the doctor of her doctor.
Scared to get her or anything because she's fallen twice and hurt herself. Her whole arm is not, it's got a reverse shoulder replacement and then a plate with 4 screws. She just did this in October, this bottom part. Now she can't even use her dominant hand, and they're afraid to give her anything.
I will come to that also. It is part of this thing, but this thing is very important what you said, because you have a fall problem too. So we are going to talk about falls also. So I was talking about psychosis. If they have psychosis or psychotic features, there are so many patients who need a lot of medication at this age, and every 80-year-old I see them, they are taking a lot of medicines. I try to cut it down, and now here mom is needing too many antipsychotics because one medicine doesn't control her. 2 medicine don't control her. She is not able to sleep. She is pacing around. Now there are some, they are mentally they are completely gone, but physically they are good. Now they are pacing. They are pacing inside house and sometimes they are pacing outside. They wander. They are patients who are lost completely, and they are like safety concern. One daughter came to her father's house, and father was having mild dementia, and he was sitting at home, but temperature outside was 32 and inside was 32 too, because he has left the front door open. He was sitting in a sofa and shivering, but he did not know what to do. He did not know what to do. He has lost that capacity to judgment.
Dementia?
Huh?
And that's mild?
No, he had mild. That's what I'm saying. I'm going there. So he had mild dementia, but all of a sudden he got some mild stroke. Stroke can cause vascular dementia, which is like this. Vascular dementia can take away your memory like this. Today you are good and tomorrow you are nothing, no memory. So all of a sudden he had a mild stroke and he was sitting at home. Now what you do? So you have to make those decisions. And so how to, these are the things, they hate somebody, they use offensive words, major agitation and pacing around the house. I wrote these so that I know all the points, but I wrote it so that I keep a rhythm going. So let's go to next. So, we talked about calculation and going to grocery store, buying things and all that. Sometimes they don't know. They take out dollar bill, okay, I have $100, you give me money, If I am the cashier, they might not get any money back, things like that. So we talk about mental condition. Now physical condition and activities of daily living. That is extremely important. So mobility. So some people are completely mobile. They have no problem in walking, So you don't have to make much do decision making in them. Even if they are 90, I have 90-year-olds, they are completely walking without a cane, and memory wise good. But again, I have a couple of 60-year-old patients. They are walking, but they are completely demented. No memory, 60 to 63, no memory whatsoever. So now your memory is gone, but physically you are completely fine. You think I am good, but they are not even recognizing their spouses or kids or anything. So then it makes a tough decision, like you have to put them in nursing home, because now you cannot even, because they are physically strong, 60-year-old is a physically strong person. You cannot control them at home, You have to have them in a skilled nursing facility, especially in a dementia facility where they can be taken good care of. So talking about mobility now. So mobility, again, there are 3-4 levels. First is all of us, we walk without cane, we walk without walker, we are not wheelchair bound, we are not bed bound, all of us are walking. So these papers which I gave you, I want you to write the points which pertain to you. So in the evening you can reflect back on them. Don't write all the points, but the points which pertain to you in your situation. So now there are so many patients, even 70-year-old, we tell them to use a walker to walk, but they don't use walker. They have falls. We tell them you cannot walk. But they mentally they think they can walk, and they are supposed to be wheelchair, but they try to get out of wheelchair and they fall. When you fall in elderly people, you are going to have some injury, which sometimes is traumatic, big trauma, like hip fracture. I've seen brain bleeds because of that, and now there are so many patients on these blood thinning medications. A fall with blood thinning medicine can cause such a big problem. So mobility is very important. Now I'll give you an example of another patient. She is on wheelchair. She's mind-wise she is completely fine, but she has a condition. Because of that, she is on wheelchair. So the daughters, she has 2 daughters, and they are very caring daughters. But there is a time of the day between 8 and 1, she's alone in the morning and afternoon, 8 to 1. So one daughter stays from 1 to 8 and at night, and another one comes at 8 at night and goes to 8 in the morning, because both of them work. So there is 5 hours, nobody is there to take care of her, and she is perfectly fine mentally, but she is wheelchair bound. So she says, Dr. Moolani, there are times I'm sitting in my poop for 5 hours because my daughters go at 5, but at 8 o'clock, but nobody's there at home till 1. She's getting recurrent urinary infections because sometimes she's incontinent and she poops on herself. And it is not that the family doesn't care, they care a lot, but they are not financially strong enough to have a help for those 5 hours, and those 5 hours she's alone. So where she will be safe then? In an environment where there is care 24/7. Because although, so I will get back to, I've written some more points on that, But so this safety thing, she looks perfectly fine, but we are not able to take care of her 24/7 and she needs care 24/7. In that condition, she has to be either get some help for those 5 hours if you can afford, and if you cannot afford, then it's better environment in a nursing home, because at least she will be. There are some instances in nursing home this happens, but most often than not, you get help. You get helped. So mobility. There are some who are bed bound. Like bed bound person literally needs to be turned every 2-3 hours. So you can hire some help for that, but if you are not able to hire help, that's tough. Then it is not safe for them to be at home, because then they will get bed sores. So either this, which is a safe environment. So but that was my main point also. What would be the safe environment for the parent or spouse? Here a spouse also. What is the safe environment for the parent or the spouse? Like if you can provide 24/7 great care, there is no problem. But in certain conditions where they are psychotic, where you cannot manage them, then they have to be under an institutional care, and that will be good for them. It won't be bad. So we did talk about driving. So continence, continence, bowel and bladder continence, I just touched on it. So there are elderly patients, they are walking, but they need pull-ups, because they are urinating on themselves. But they change it themselves, that's not a big deal. They change it themselves, Sometimes they need a couple of time help, somebody to come at their home, like home health agencies come and give them bath, things like that. So that's perfect. But when, as I said before, they cannot change their diapers, then they need more care than we think. At that time, that is a tough decision to make, like when to make that decision. Now, again, from their perspective, you have to see what are they thinking, and what are you thinking? Because again, parents don't listen. Also, we don't listen. So, the more we listen to them, the more they will listen to us, and slowly and gradually, they will accept their reality. It will come to accepting the reality. Like this is my reality. I need to move to maybe assisted living. Assisted livings, they're recently researched it. There are assisted living, they get a lot of help, but you have to pay a lot also. Like sometimes you have to pay 5,000 a month, but you can get help. All these bathing, grooming, they clean you up and everything. They clean your room. So if you cannot provide it, and your parent can afford, or you can afford, you can put your parents in assisted living, which is I think is a very good place, because there are so many people. You have some social contacts going on. They have activities. They go to movies. They go do certain things, which is excellent. Especially if you think that you don't have too many friends, or mom doesn't have too many friends. They suggest, Mom, do you think assisted living will be a good place for you? Because this can be extremely good for mom. Going to assisted living, they will have 3 meals a day, social company, and especially you are visiting also off and on, and they will make new friendships. They will play bingo and cards and whatever they can play, their mental status suggests. It is not just And assisted living, we have to think it like a hotel, basically, where you check in and you are being provided. I read something where people, I do not think it applies to 80-plus-year-old, but some 70-year-olds, they are just living in cruises because cruise is much cheaper than assisted living. You know, they are literally living in cruises because a cruise is $300 for 3 nights. You know, so $3,000 they are just cruising around the world. You know, there are 6-month cruises and things like that. But again, a cruise does not have. They say they have a doctor, but the doctor does not have medicine. They has aspirin and things like that. You know, so don't think about cruise. I'm just saying, you know, mom can be good in cruise. She's just 91. She can cruise around the world. No, you know, so yeah, so grooming, dressing, these are the activities of daily living. You know, and meals. Meals is very important. So if a daughter can provide meals, or son, I don't use daughter because that's what I see usually, you know, or son can provide meals, that's good. But sometimes elderly people, especially those who are living alone, they are not cooking, or they are cooking 1 meal a day. Sometimes they skip a meal. They completely skip a meal, you know, and sometimes the refrigerator doesn't have things. Sometimes the weather was bad, they didn't get out to go groceries. So it's very important to see whether will they be good enough at home, they will be safe enough at home, or assisted living, or skilled nursing facility. Because that is a tough, because assisted living, many of us think, oh man, this is a place of nowhere. It is not. It is literally like a hotel. It is literally like a hotel, you know. You are just, but again, hotel is not home, you know. Hotel is good when you are on honeymoon. Hotel is not good when you are saying, I'm not coming back home. Everybody likes their home, you know. So everybody wants home. But assisted living can be the closest thing to home, because not only there are people to take care of you, you get 3 meals and 3 warm meals. I think most of them provide warm meals. So 3 warm meals a day you get. That's so important, you know. So they will get nourishment. So somebody said that the mother is not eating. Who said that? You said that, isn't it? Yeah, Gwen said that mother is not eating. So in dementia, I would like to talk about that. Mother is not eating. So first things is, do they have dementia? If they do not have dementia, then you have to see some medical condition. So doctor has to figure it out, you know. So this is not a medical treatment, but I am just trying to help. So if there is, patient doesn't have dementia and they are not eating, there could be some medical condition, like some mild infection. Sometimes they don't eat. They are keeping urinary tract infections, and but in dementia, in advanced dementia, this happens. Patient cuts down eating because body is literally shutting down, you know. So I see it a lot. Children come to me, mom is not eating, she's losing weight. You know, this Medicare also dings you if the patient is losing weight in nursing home. But we have to think like that. Is the body shutting down? Is the dementia that bad that the body is literally shutting down? And at that time, you talk to the doctor and ask them, how much time my mother got? You know, is her body shutting down? Because that's a natural disease progress state. The disease is progressing. It has affected the mind first, now body, and body is literally shutting down. when body is literally shutting down, don't try to give your mom medicines and make her work hard on that. She has few weeks to few months left, so it's better that she enjoys her time. You know, sometimes we give, mom cannot die. You know, I have a literally, I'm not kidding, I have a patient, she was 99-year-old. The granddaughter was a nurse in the hospital, and granddaughter herself was 50. But she said, Dr. Moolani, my grandma cannot die at 99. I said, why? She's 99, she has to make it 200. Literally, she said that. I was like shocked. There is nothing, nobody in this world who has stopped death. Okay? You know? Sorry, I am not a wrong doctor for that. You know, I cannot stop somebody from dying. I mean, I can treat them, yes, but there are some things when doctor will say, hey, sorry, we can't help it. So if the body is shutting down, don't try to force things on that, force feed or put tube, you know, like dementia patient not eating, no. Okay, first try this medicine, Dr. Moolani, there are 2 medicines I have read on internet, Google is the boss, you know, Google says give Remeron, if Remeron doesn't work, give Megas, and if Megas doesn't work, put PEG tube. For what? For what? You have to understand that, you know. Is there a quality of life? You know, after safety, after we have taken care of safety, then there is a point where we come, what is the quality of life left? You know, there are patients who say, if patient can make decision themselves, if they have made it very clear, this quality of life, whatever it is, I want everything done, if they have made it, that's okay. But if you as a child are making decision and you have never discussed with your parent, then decide what is the quality of life. Do I want to be like that? You know, like when I am 94-year-old, do I want my kids to do this to me, which I am doing to my mother? You know, so safety, we have talked about safety and we will still keep on talking about safety, but there will be time when we will only talk about quality of life. In the hospice, this is where the hospice comes in, this is where the palliative care comes in, you know. So safety is basically like home health and these buttons which I talked about, iPhone, iPad watch, and 24/7 care. But then there will be quality also. How much quality mom has. You know, if I am her, would I like my kids to do too many things to me? So it is better when you are listening to these, write these points down so that you can make decision. If you cannot make decision for your mom, at least you can make decision for yourself and write it down and give to your child. Hey, if this happens, don't do too many things to me. Or you know, if you want too many things done, that's okay also. Whatever your decision is. My goal is not to give you the decisions. Decisions are going to be yours. But these tough decisions, where patient can be safe, where can be, what is quality of life and all that thing. Decision is still yours, you make the decision, you know. Or when your parent is completely in great mind, they should make the decision.
You talked about did you say something about medicine at a point too?
I'll be coming to medicine also. I'm coming. Unless you have some specific question.
No, I thought you said medicine and food, don't force it on them at a certain time.
Yeah, but that is what I would do. But again, you know, everybody, at that time I want you to look at the quality of life. You know, and I will touch more on that. But again, why we are forcing, why we are doing that? That should be our question, you know.
It's just more for yourself than anything.
Yeah, that's what, you know, are you doing it for your parent or you're doing to yourself? You know, things.
What is palliative care?
Palliative care is when you have decided that, like hospice we call when patients' life expectancy is 6 months. Palliative care is like somebody has bad COPD, bad heart failure, and they are having trouble in breathing. So palliative care helps you release that anxiety. They provide them behavioral support, medicine support to help you in that thing. So that is palliative care. Hospice,
They come out once a month.
palliative care people only come once
They
a month.
come once a month, and then when you're in hospice care, then they come 1 to 2 times a week, and it's an easier transition
Yeah, it's a easier transition, yes.
compared to
Because it's the same, here in Owensboro we have same company doing both. And I think most places it is same company doing both. So we talked about mental condition, health condition, physical condition, now health. So what are the health conditions? So first thing is medications. There are parents, I give them, patients, I give them 30 pills a month. They come after 3 months, they still have 1 or 2 pills left. They tell me they could not afford the medicine. Though many of them are rationing. They see which one is cheaper, they buy that medicine. Costlier medicine, they don't buy. Because they cannot afford. And some people have memory issues. They cannot, if the medicine is 2 times a day, they take once a day. I mean, let's not talk about elderly, even young people, I give them 2 times of medicine, they take once a day. Like, are you sure you are not going to, you did not take it 2 times a day? Dr. Moolani, I swear, I read it once a day. I said, where did you read it? I don't know, Dr. Moolani, this bottle says today it is saying 2 times a day. Today it is saying, I said, this was saying it for last 1 month, But they only took, so they have those 60 pills, but 30 are left because they were very good in taking once a day. But they did not. So check the bottle, see. I mean, even you'll be surprised how many men come to me and they don't know what medicine they are taking. So they say, can you talk to my wife? She knows what medicine I'm taking. She just puts it there, I take it. I say, what the heck, man? I thought only Asian men are bad. So, my wife also has to remind me for my blood pressure medicine every morning. Did you take your medicine? Yeah, I took it. So, can you go back? Do you know how to go back? Okay. So, they stop. And so, side effects of medicines. Very important. This is extremely important. Like mom has knee pain, daughter takes Norco for some reason. She thinks Norco will be great medicine for her. Okay, she comes to doctor. Most of us doctors are easy prescribers. Instead of talking with let me get rid of this patient right now, So, but Norco, Xanax, there are hundreds of medicines which are not good for elderly, especially gabapentin, Norco, Xanax. Patients can have falls. These cause big time falls because they make you drowsy, they make you dizzy. So going over the medication, cutting, the most important thing if you are going with your mother to hospital or to the doctor is asking the doctor which medicine we can cut down, which you think is unnecessary, which you think is not going to improve mother's quality of life and improve her life expectancy. Sometimes improvement in life expectancy is not important. Quality of life is important. If you're bed bound, you're hurting, that's perfectly fine to take some Norco. But you're walking around and just mild pain in the knee, you should not be taking Norco because it will make you drowsy. There are elderly people, they are on Percocet, morphine and all that thing. So they become prone to falls. So make sure, talk to the doctor about the side effects, or better still, there is a Bears criteria list, print that out and see, but don't stop medicine by yourself, okay? Discuss with the doctor, are these medicines necessary? Because because you did not start the medicine, you should not have the right to stop it too, unless you have a bad reaction to it. Then you should stop it and then call the doctor. But if there is no bad reaction to medicine, don't stop the medicine, just because you read on Google, So Google tells you half of the picture. What? So Google is not that.
Question.
Yes.
My mom, a couple years ago, she was on statins. I don't remember which one. And it literally was taking her brain away. She was where she'd drive out 54 and can't go to Kohl's, can't remember how to get back, and just keep heading farther out of town. And luckily, she could still remember how to use her cell phone, which she can't now. But she'd call me, and I'd have to figure out where she was and bring her back. Luckily, see, I'm copying her now. Luckily, they took her off statins a year later, and within a couple weeks, her brain cleared up and she was good. And then they put her back on it in less than 2 weeks. I saw her brain going again. So we finally convinced her 6 months after that to talk to her doctor, because she was certain she just had dementia, didn't want to admit it. And her doctor took her off that, and some of the effects are still there, some aren't. But she's gone to a lot of doctors, and like when she went to the hospital for stuff, and they're like, she should be on a statin. And it's like, no, she shouldn't. We finally just started telling people she's allergic to it, because then they won't bug us about it. Is there a better way to do that? Because I don't consider that actually allergic, but if she takes it, her brain's gone, and she made the decision she'd rather have her brain as much as possible than worry about, what.
So far, was she diagnosed dementia or not?
Huh?
Was she diagnosed dementia?
She's a 60 on the scale last time they did a test.
Mm-hmm.
And that was after they stopped the medicine.
Okay. In advanced dementia patients, I stopped statin completely.
Yeah.
What are we trying to do? That's what I think, But in mild dementia patients, it's up in the air, because mild dementia patients sometimes have mild dementia for quite some years before they turn bad. But your question is how to talk to doctor?
Yeah, I mean, I guess we could keep going with she's allergic to it, but that doesn't seem honest. I don't know.
She's not allergic to it, but there are some statins which will be, I would say, are safer than others. In elderly, I would say Crestor might be safer because it does not cross the blood-brain barrier. So Crestor might be safer than Lipitor. So that's what I would suggest. But again, if any medicine causes you confusion, you should stop it, because confusion can have immediate bad effects. You don't want immediate bad effects, So because here statin, what does statin do? It protects your heart from getting a heart attack or brain from getting a stroke. But again, if you are confused all the time, you can wreck a car, Then your life expectancy all of a sudden is gone. So it's always see the pros and cons, So
I've got something similar since we're on the subject. Maybe other people have experienced this, but my mother takes blood pressure medicine, and her blood pressure is very erratic. They're having trouble getting it under control, but it's giving her some bad side effects. She doesn't want to take it, but she knows she has to take it. So
is she rationing because of that?
excuse me?
Is she not taking medicine because of that?
She takes it because she has to, but when she has some of these bad side effects, she'll stop it for a day or two. She'll be like, I can't take it anymore. I've got to get myself.
Maybe that is why your mother has erratic blood pressure problem. because sometimes she takes the medicine and sometimes she does not. So when she takes the medicine, her blood pressure is controlled, and when she's not taking the medicine, her blood pressure is high.
When she tells me about it, she says that she's taking it like it's prescribed, like she's supposed to. But
You can so easier way to check it, to count the pills, the day it was dispensed and now, like it has been 10 days. So if it is 10 pills she's supposed to take, if 10 are gone, then she's taking. But only if
I've not done that yet.
if 7 are gone, then she has skipped 3 days.
But if, let's say that this blood pressure medicine is causing all these side effects. She complains of brain fog, she complains of dizziness, she complains that it's affecting her hearing.
So let me tell you about this blood pressure. In elderly people, blood pressure should not be strictly controlled. Should not be strictly controlled, because when it is strictly controlled like 110/70 or 120/80, they are very prone to falls. They are prone to falls like that.
She complains of her stomach. She says it makes her stomach feel bloated.
Yeah, I mean, again, I don't know which medicine is that, but again, so it is better to have a blood pressure of 160/90 than 120/80 in elderly people, especially if they are above 70, above 80s, because we have to again look at the life expectancy. What is the life expectancy at that age? Okay? And what does blood pressure do? Blood pressure causes stroke, heart failure. That's the thing. But if she is dizzy and lightheaded and brain fog, you're completely confused. Why give the medicine then? Which medicine can we cut down? Perfectly fine to cut down. Like diabetes. Diabetes, the goal in young people is completely different than elderly. In young people, we control diabetes strictly. I want the A1C 6.5. But in elderly people, when I see 8 A1C, I am very happy about it. When I see 6.5 A1C, then I ask them, do you have readings below 70? And you will be surprised how many times they have readings below 70. The reason is the elderly people skip meals much more than what we recognize. They even skip meals in nursing homes. So we will control their blood pressure and sugars very strictly. Sugar, low sugar, do you guys know low sugar can kill you instantly? Hypoglycemia can kill you instantly. Instantly means 30 minutes, you're dead. You know, for long term hypoglycemia, you can die, literally. So, it is better to have high sugars in elderly than low sugars. It is better that A1C stays around 88. So, it is extremely important that sugars stay high than low, because low sugar, one day it is 80, next day it will be 30, because they will skip a meal also. So, it is better to have high sugar, it is better to have a little bit high blood pressure. You know, that is perfectly fine. So, if certain medicine is causing confusion, brain fog, dizziness, drowsiness, lightheadedness, stop the medicine. I think she's going to write a book on this.
I am.
Good. Very nice. If I have to take notes, I will get it from you. So, life expectancy. So, this is very important. If you are 80-year-old, what is your chance? Let me explain different. There are only 40 men above 80 out of 100 people. If you take 100 men who are born today, only 40 will live beyond age 80. Only 40. 60 will die before age 80. women are better, you know. Women, 43 will die before 80, but 57 are still alive. Out of 100, 57 are still alive at age 80. So women, life expectancy of women is high. Why I said 80? Because that's the average life expectancy of a man and a woman. Woman is a little better and man is a little worse. I think man is 78 and woman is 81, something like that. But average life expectancy is, let's say average is 80. So certain conditions, so we will talk about those conditions. One is emphysema. Those who have parents who smoke or those who themselves smoke. How bad is the emphysema? Are they on oxygen? If they are on oxygen, are they on 2 liters or 3 liters? Now they have things like BiPAP. People are on BiPAP machines also at night, you know, and Trilogy machine. I have a patient, she's on Trilogy machine every night. One night she misses it, next day she's in the hospital because carbon dioxide builds in her system. So she's completely confused next day. We have to send her to hospital. So this is the very important too, that if you have COPD, we are talking about health conditions. If you have COPD, how much oxygen you are you on oxygen or not? Because if you are on oxygen 2-3 liters, especially 3 liters, it means your life expectancy is short. Talk to your doctor. Talk to your doctor about life expectancy. What is my mother's life expectancy? She's on oxygen 2 liters, 3 liters. And how bad are her lungs? Sometimes oxygen is only given temporarily also because you have some infection. So just because you are on oxygen doesn't mean your life expectancy is really bad, but can be temporary thing also. But if it is permanent, especially once you are on oxygen, it means your damage is quite significant. Second thing is heart failure. I have seen patients who have 10% and 15% heart function. You know, the normal heart function is 55%, 55-60%. I have seen people with 10% heart failure living for a couple of years, you know. But again, when heart failure is bad, you know, how many of you think cancer is bad? You know, everybody thinks cancer is bad. But when heart failure is bad, that is equally bad also, you know, it is equally bad just like cancer. But there are some cancers which are easily treatable, completely gone, curable in fact. But heart failure, especially in elderly population, if it is really bad, severe heart failure when they have, you know, ICD and all those things, it is bad. So life expectancy, you have to understand the life expectancy also. What is my mother's life expectancy? The cancer, like small cell lung cancer or pancreatic cancer. Whenever small cell lung cancer or pancreatic cancer is diagnosed, that basically kind of it's a death sentence, you know, because I have only seen one patient with pancreatic cancer living 3 years. I've seen so many patients. Most of them die within 6 months. Small cell lung cancer, they die within 6 months. You know, so health conditions, it is very important for us to understand whether they have cancer, whether they have bad lungs, bad heart, all these things, or neurological condition, you know, like brain. We talked about dementia. There are some patients with dementia walking around, but there are others who have a stroke and their left side is weak. But you will see, I have seen patients, they have bad stroke, one whole side is weak, but they live for a good number of years. They live for a good number of years. But there are other neurological conditions like MS, multiple sclerosis, where the body is slowly stop functioning, you know, motor functions are going down, and it is a usually slow process, but sometimes you have to ask the doctor how, like if somebody is already bedbound with multiple sclerosis, how long they got. Parkinson's disease, Parkinson's disease, slowly, you have a speech problem, you cannot swallow. I had a patient in nursing home. He used to, in his younger age, he used to teach ballroom dancing, and he developed Parkinson's disease. So when I saw him first time, he was on wheelchair, but he used to talk and everything. But within 1 year, his Parkinson's got so bad that he could not talk much and he stopped eating. But he could understand. Many of them lose capability of understanding also because they develop dementia. But he could understand very well. So I sat with him and I asked him that you cannot eat. Do you want a feeding tube? So he took 3 minutes to say, Dr. Moolani, I think time has come. Don't do too many things for me. But he still lived for 1 month without food. He was drinking water. He lived 1 month without food. So this thing, how bad is Parkinson's disease? How bad is multiple sclerosis? How bad is dementia? How bad is heart failure? We have to understand that, and discuss with the doctors. And then that should determine what we want to do. So safety and the quality of life. So as I said, condition curable, like some cancers are completely curable. Okay, keep on going. So caregiver's condition, now mom is, you will see there are so many moms who are 95 there, but their kids are in their 70s too. Mom is 95, kid is 75, like son is barely walking with his own cane, I remember one case, I still cannot forget it. That lady was again Mary, So there was one elderly guy, he used to come with Mary. 2 years he came, very nice both of them. So one day I saw this James, I said, James, what are you doing in the hospital? He was in the hospital, near the cafeteria. He said, Mom is here. I said, Mom, which room? She said, he said, the room number. I went, oh, that was Mary. I always thought they are a couple, they're husband and wife. I was like, yeah, this is bad, because I never asked them the relationship, because this guy looked old enough to be like a husband, and I was like, ooh, how wrong I was, So this was his mother, and so mother, him, and his wife, all of them, like Mary went dancing. I don't know, there is a dance thing, so where you go give $5 and these elderly people go and in the evening. So they all used to go dancing 2 times a week. 2 times a week they used to go dancing, and she was dancing at age 94 till she broke her hip, and she went down fast. After that she did not last long. But they used to go dancing, all 3 of them, daughter-in-law, mother and son. They all went dancing. So I saw them last time. It was in the nursing home when I saw Mary last. And for them, James was like, mother had a good life, Dr. Moolani. I don't want too many things done to my mother. She loves dancing. She would not like to be in the bed like this. So I know we cannot make it quick, but make sure don't do too many things for mother. And he was very clear about it. So there are times, if a parent is 93-year-old and all of a sudden they have some bad illness, you have to understand how much life they have lived, what was their quality of life before, and if they have, not even whether their quality of life was good or not, but they have lived their life. They have enjoyed whatever they have had to enjoy. They have done everything what they could have done. What are they going to do now? Am I going to help them or not? So as I said, like some children are as elderly looking as the parents, So they have physical disabilities, they have financial problems, So we have to understand, okay, I want to help mother. My favorite thing is, I promise my mother that I will not put her in nursing home. I promise that. And so because of that promise, mom is sitting at home without 3 meals, laying in her poop, because I promised her that I will never put her in nursing home. Now she is not safe, she does not have quality of life, but I promised her. So it is not, again we have to think, it is not about me. It is better for me to break my promise and give quality of life to my mother. So can I give quality of life to my mother? Or if the mother has told exactly that, okay, keep on doing everything for me, that's perfectly fine. Because that is her decision, she made the decision in her conscious mind, that is perfectly fine. But if you are the decision maker, look at the safety and look at the quality of life. Just because, I promised. It is your promise, it's not about you. It's about your mother or father. Break your promise. For your promise basically was more of a safety promise than keeping her at home promise, isn't it? We will keep you safe at home. But if she's not safe at home, then it's better for her to be a place where she's safe. So let's go over the slides, what have I written. So again, can you genuinely take care of the mother? That is very important decision, that is very important to write also. Can I genuinely take care of mother? Can I provide her 24/7 care? Can I provide her food? Can I take her out? All these things, because here many of us have our own kids. Our daughter got divorced. Now, we have to deal with her. Now we have a mother and daughter. Which one to deal with? We're completely crazy. Dr. Moolani, give me some Xanax. Because I have problems going on. Yeah. So, okay. And guilt and shame. Like, again, the daughter from Arizona. A daughter from Arizona, it can be North Carolina, South Carolina. People call me from all over the country when their mothers are in nursing. I go to 2 nursing homes. They call me. I want everything done for my mother. When was the last time she saw her mother? 2 years ago. So I'm not saying come from North Carolina to see, because so many things in our lives going on, but we could not go. It is not my judgment call to make the decision, because there are so many things. Sometimes we don't even, I know they don't have finances enough to come from South Carolina to here. So they don't have money to put gas in the tank. But they think good about the mother, but they don't know the condition of mother. They don't know how much mother has deteriorated in the last 2 years. They don't know that she is in the nursing home and she's being taken care by the people who know her much more now than she knows her. So it's better to call the nursing home staff and ask about the condition instead of telling them. You know, this is my favorite thing, as because your mother is in nursing home, that does not make you a doctor. My mother would give him this medicine. I like you. Right now, before coming upstairs, I was arguing with a daughter that my mother is taking this medicine for 10 years, you cannot stop it. I said, look, she was taking, I don't have problem, but this medicine is making her fall. You know, this medicine is not great for her now. It was good, maybe 10 years ago, maybe even 1 year ago, maybe 1 month ago. But now her condition, she is in 10 years, she is 10 years older. You know, so many children are, we have to understand, are we doing it because of our guilt? There's a guilt that, oh my God, I could not take care of mother at home. But that guilt is, I would say, unfounded, because sometimes we don't have financial support or physical support or social support to take care of parent at home. It is just, or even assisted living, because assisted living cost is $3,000 to $5,000, sometimes more than $5,000. You know, everybody cannot afford it. You know, so it is better not to feel guilty or ashamed of it. Instead, not to feel guilty and do the right thing for your mother or father. That is the right thing. You know, where they will be safer, where they will be, where they will have quality of life. You know. Yeah, so overwhelmed, you know, I talked about. We all have other things going on also. So we do the best, but again, there are times when things are not in our hands. They are not in our hands. And so we have to do the right thing still, you know, maybe look beyond us and see the safety. So, CPR and ventilator. How many of you have a living will? Good. So many of you don't have living will. That's perfectly fine. So, mother gets admitted to hospital. She is again 94 years old. She doesn't have a living will. She was perfectly fine. You know, no mental problem, no physical problem, no health problem. She is on ventilator for 5 days. The 5 kids, doctor comes to them, you know, what you want? They say, do everything. 2 say, do everything. 3 say, oh, I think mom didn't want that. Now there is internal strife between kids. This small thing can linger on for years, you know. And this happens in all types of families, educated and non-educated. I wanted mom to be on ventilator and he said no. And they don't talk after that. Mom is dead and they are not talking after that. So it's better when mom is alive and she's able to make the decision. Tell her to write what she wants. Explain to her what living will is. You know, talk to the doctor. It is about CPR. Do you want the CPR done if God forbid if you stop breathing, if you die? Would you like to be put on a ventilator? You know? Or if you are not making the decision, tell your child what exactly you would like to do. You know? Write it down. Write everything down. Like, okay, if my condition is this bad, do CPR or don't do CPR. If I am demented, what you do. If I cannot make the decision, what to do. So your child has a guideline to follow. Because for you, it is easy to make the decision for yourself. But when it comes to making your parents' decision, it is tough. And especially if there are 5 siblings involved or 2 siblings or 3 siblings, and one is saying something and 2 are saying something else, it is so difficult. When to do CPR or not. So make the decision now. If your mom can think about it, tell her to write it down. God forbid if something happens to you, would you like to have CPR or not? Would you like to be put on a ventilator or not? You know, would you like a feeding tube or not? So, some people don't understand. I want everything done. You know, all of us are getting older. It is better to visit a nursing home, see what dementia patient is like. You know, see, would you like to be in this condition? Would you like to have dementia and on ventilator? I have seen extremely severe dementia, completely they don't have any clue, but they are on ventilator because they did not make the decision and kids did not have the power to make the decision. You know, they are on ventilator. They did not make the decision, and children, a couple of them are saying do this and do that. Okay, they are on ventilator. You know, whether it is right or wrong, that is not our judgment call. But it is better to make the decision. When you can make the decision, you write it down. So what you want. But when it comes, like then again, you know, like a 94-year-old is on ventilator, doctor says, what you want to do? See, again, quality of life. If mother survives this, what type of quality of life she will have? No. If we do CPR on a 94-year-old, how many ribs will be broken while doing CPR? CPR is a very painful procedure, you know. I can do it on Jeremy. Jeremy is my buddy. And show it. No, just kidding. So Jeremy can tell us, he's a, you know, yeah, he might be the youngest person here. So he can tell us how painful it is, you know. Just imagine this pressure you put on the ribs of 94-year-old or 90-year-old or 89 or 88 or 87-year-old. They are frail people. Their bones are weak. Do you want to do that? Will they have very good quality of life after that? Okay, if they survive, what will be quality of life after that? This decision should be about quality of life and safety.
Do children have the right to make that decision for a parent if it's no living will there?
If there is no living will, it is the children's right, yes. Unless the children cannot make the decision themselves, you know, agree or make the decision themselves, then the hospital has different type of ways to make the decision, you know. But again, it will come to children. So that is why if you make your own decision, it is easy for you in your right mind. It is extremely difficult for your parents, you know. Oh, it is extremely difficult for your kids to make the decision. Because kids have at that time emotions going on. Sometimes the decision is a split-second decision. Do this. Yeah, go ahead, do it. They don't have time to think about it. Mom cannot die, you know, because they are too attached. There are some children, they don't want their parents to die at all, even at 95, 96, because that is the only social connection they have. They don't have any friends. So out of their own selfishness, they don't want the parent to die also. What will happen to me when the mother dies? You know, where will I go? I don't have any friend. So make sure you have your own friends, you know, beside your mother and father, so that your decision capability is not, what do you call, clouded with your own biases. You know, we make a lot of decisions because of emotions, selfishness, guilt, shame. You know, so when when it comes to this, think about them.
I have a question. I've always had a question about the ventilator. I've had circumstances in my family where, now this is what I was told. I had a half sister and she was put on a ventilator so her body could rest. Well, she never came off. She died. But then I had another cousin who was also, we were told the same thing, but she survived. So how does a person know for sure that it might just be just for a short period of time?
Only the doctor at that time can tell you.
Mm-hmm.
Only the doctor at that time can tell you what type of condition is that. Sometimes if it is bad lung disease
Mm-hmm.
or heart failure, patient can get better, but their quality of life, you have to know beforehand what was their quality of life and how it will be, you know. But again, if it is sepsis, like a young guy, all of a sudden develops infection real bad, and doctors say put him on ventilator, we can save him. There are many instances. I mean, we put even elderly patients on ventilators all the time because they have said that, and they come out of that. They get better. But again, in the long run, there are many who say, Dr. Moolani, if I talk about my quality of life, if I'm getting on ventilator 1 or 2 times, it means I don't have quality of life left. So it all depends on that time, what the doctor is saying. Okay, so it is not easy decision for a child. It is not easy decision, but living will in 80-year-old should have a living will, whether they want CPR or not. Like if there is an infection, it can get better, but if your condition is stage 4 lung cancer or severe heart failure or severe lung disease, what is your quality of life being after putting you on ventilator? Will that improve the life expectancy? You know, like in a young person, of course, he will survive and he will get better and he will be completely fine. But in a 89-year-old, 90-year-old who has a bad disease, even if she survives, what is her chances of living 1 month or 2 months or 3 months? And what will be her quality of life after she is extubated? Will she be bedbound all the time? Will she be able to think? So this quality of life again, so that is the thing you have to understand. What will be the quality of life? We can put on ventilator, that's not a big deal, you know, but what will be the quality of life after that when they survive? You know, so elderly patients, you have to see quality of. Young people, by all means put them on ventilator, get them better. They will survive, they will get better. But there are young people on bedbound, you know, there are some sick young people too. Like I know 3 brothers, they were diagnosed with a neuromuscular problem. All 3 of them died. I mean, they were born with 2 years difference. They all died at age 21 to 23. They were diagnosed very early in their life. That I forgot their dystrophy, I think it's for Duchenne's disease. And they knew that either they will die when they were 19, 20 or maybe 23, 24. They all died. They were never put on ventilator because the disease condition was like that. It just progressed and progressed, and they knew they were going to die one day. Their breathing will stop. Their mind was good, but breathing stopped. So again, that is again quality of life. That in those boys, no, they were not put on ventilator because their condition was progressive. So if it is condition is progressive where there is no quality of life left, what's the point? You know. So look at the quality of life again in that. So when it comes to CPR and ventilator, quality of life. What will be my mother's quality of life? You know, when a doctor comes to you, I don't think your mother is going to make it tonight. Would you like to put her on ventilator if something happens to her? Would you like a CPR? That is the time to ask the doctor, okay, what do you think my mother's life expectancy is? If she's 90-year-old, why I said 90? So when you are 90-year-old, your average life expectancy is 80. You have already lived way beyond the average life expectancy. What percentage of people live beyond age 90? Do you know? Just guess. Between 4 and 5. Again, yeah, though 4 people can live, 100 out of 4 are living. What's the problem, Dr. Moolani? I don't have problem. It is for you to decide. If you have good quality of life, by all means, you should live to 100. As I said, I have a patient of 108. She was playing bingo and reading newspaper. You know, I did have a patient like that. So there is nothing wrong. If the quality of life is good, go ahead, do everything. Your decision should be made on the basis of quality of life in elderly people and where they are safe. Yeah. So, and again, as I said, would you yourself would like to be as a 91-year-old or 92-year-old when you are yourself that sick? What would you like to make a decision little easier? What would you like to do to yourself? You know, maybe then make the decision for your mother or father. Like, I am 92-year-old, I have bad lungs. What would I like? But I am 92-year-old walking around completely fine without a cane or anything. What would I like to do? So make the decision, put yourself again. This time you put yourself in your shoes and see the future. Like 30 years down the road, I might be 85. What would I like to do, you know? So you call your daughter, hey Jennifer, don't put me on ventilator when I am 85-year-old. If I have this condition. So, okay, next. So again, this is the last slide. Listen to your parents, put yourself in their shoes. So again, same thing. Understand their feelings. It is very difficult for us to make the decisions. But when they are in their sane mind, talk to them more, get everything in writing. You know, these decisions, this discussion is so bad, you know. This discussion is so bad. Mom, when you are 85-year-old in the nursing home, what would you like us to do? Why you are asking these garbage things, you know? This discussion is so bad discussion. But this discussion needs to happen so that we follow what their wishes are. It is better when they are in their sane mind, we discuss that and get everything in writing so that when we have to make the decision like ventilator, now you take out the paper, what it was written on it, instead of your emotions. You know, this is my mom's wishes. That is better. That's about it, you know. Thank you. So, you guys have a question, sister?
Can I ask, do you have an opinion about surgeries in people in their 80s and 90s where they go?
They are getting surgeries. They are getting bypass surgeries. They are getting knee replacements.
What about general anesthesia in the elderly?
I think general anesthesia is very safe nowadays. So, there is no problem.
Isn't there a connection between dementia and general anesthesia?
Well, there may be, I don't know that. I don't know literally. But again, if they're after knee surgery, they will, if like for example, if their condition is extremely good and doctor says get a knee replacement and your mother will walk, good. If everything else is good with them, why not?
My mom had a hip replacement at 92. And
92? Oh, okay.
Full hip replacement. But the doctor insisted on a block and twilight sedation rather than general anesthesia because of some experiences that he had had with.
Oh, yeah, well, 92 is a.
She's 96 now. So.
I know. It's a tough age to give anesthesia. But I've seen patients after general anesthesia, they're confused. Right now, I have a nursing home patient. She's very confused. She has a general anesthesia 3 weeks ago, and the family says she did not have any memory issues before. So right now, I have a patient like that. So she did not have a, what do you call it? She did not have memory issues before, but now she has. And elderly people have different problems with different medicines. That's why I always believe that less is more in elderly patients, you know. Yes.
There is a form online called 5 Wishes that
Mhm.
you might want to get online and just look at it, and it's where you can actually handwrite in what you want to give, or have your parent to write that in.
Yeah, that's very important. A good one, thanks.
5 Wishes.
Yeah, you can have it.
Costs about $5.
Yes.
Is vascular dementia curable?
I don't think so.
Is
I'm
it-
afraid it is not.
Is it made, is there anything that could
Slow it down.
Slow it down. What I have noticed, sometimes vascular dementia does not progress. But how bad it is, that is, but sometimes it stays same.
She fell in 2017 the first time, and had the reverse replacement shoulder or whatever, and was doing pretty good, but we noticed, some things happening. She'd had some mini strokes, which we knew about that, and it just kept getting more noticeable and more noticeable that she was, doing odd things or,
Problem speaking. She knew what she wanted to say, but she just couldn't get it out.
and
loud.
she's French.
She doesn't speak English.
Yeah, she's
does.
speaking, but she gets confused. Sometimes she'll speak to us in French and not realize it.
And then she fell this October and had to have the plate and 4 screws in, and she's not recovered from any of that.
She's at home?
No,
No.
we had to move her to one park place,
Mhm.
which we're happy about, but she's, I don't even know what she's talking about half the time.
Well, she's had some brain scans done, and they've noticed that she has some white matter on both hemispheres of her brain.
Mhm.
And is there anything that can maybe possibly slow that down, or is that just going to?
I think I've seen sometimes vascular dementia does not progress. It just stays same. Like whatever dementia you got today, I mean, unless you have multiple strokes, you keep on having strokes, that's a different story.
Well, she had went to Evansville the first time. Dr. McCormick is her neurologist. Sent her to Evansville to Dr. Gray. They did the test at 17. She had to go back in November or something. She did not want to go. She was just so mad at herself because she knew she couldn't do any. She couldn't complete any of the tasks that they wanted from her. Just the difference between 2017 and now is huge.
Oh, she is progressing then.
And I don't know, where should I take her? Should I take her to you? Could you look at her?
No, I can look at her, but
I mean, is there
this was not supposed to be like that. Yeah, but I can look at her. You know.
I live in Cincinnati now.
Oh.
I'm traveling back and forth, and
I know this is tough for children. I can see.
she spent a week with me, and she loves my home. My husband and I have a log home on 6 acres in a creek. Always loved coming there.
But again, when you change the dementia patient's what do you call location too often, they get more confused.
This is the first time I brought her there since Thanksgiving. She cried the whole time. She didn't want to be there. She didn't understand why I brought her there. I was beside myself. I broke my heart, got her back home, we got back here, well, you know what today is, yesterday, I guess, and she seems to have settled down and, but when I leave, she's gonna be a mess again, cause I've gotta go back home, you know, I have my family there also.
It's yours, mine.
Do you have a card?
You know, I stopped carrying wallet. So, but I'm on Facebook. Everybody knows now. So how did you know me? So I can give you my number. You can call my office if you want. I can get you number to call my office.
It's worth a shot, I guess. Anything.
I can see you. Yeah, you look quite distraught.
Desperate.
Yeah. Yes.
Tired.
I'm thinking years ago they had doctors that would be called taking care of geriatric patients,
Mhm.
which is older. Is that right?
Yeah.
So, is there such a thing as nowadays, or everybody's just a family care doctor?
No, there are geriatricians also. I have a lot of experience in geriatrics, but I did not do, like there are doctors who do fellowships. I did not do fellowship in geriatrics, but I have a lot of experience now because.
Well, I'm kind of like her. I'm like, I've been following you on Facebook, you know, since you've been on there. And you do put a lot of good information out there for the general public who follows you. But I'm like, I need to bring my mom over to see you because, you know, she's in Evansville and she's in a home. She's on her own, but she gets to trot down the hallway and get her 3 meals a day. But like, she complains about the food. She complains about everything. She's hurting right now. She recently had a UTI, which if people don't know, a UTI, a urinary tract infection, can cause great confusion.
Oh, it can cause confusion.
And when you have that, do you eventually come out of that, or you sometimes don't come out of that?
If you are continuously confused, then all causes of dementia needs to be ruled out. But UTI, once it gets better, you should not be confused. Yes, ma'am.
She goes for an MRI tomorrow. Should I have a copy sent to you? Or get a copy and bring it when I make an appointment?
When you make a copy, you can bring it.
So, one thing you didn't mention is sundowners, like sundowners versus dementia.
Dementia, like some elderly people, they just get confused at night. Maybe melatonin can help them sometime, you know. Yeah, but if they're having trouble in the daytime also memory-wise, then they have dementia, you know.
Yeah.
Some people just get confused at night. Yeah.
How do you control when they go into a frenzy where they're like, almost like in a panic and, you know, how do you calm somebody like that down?
There are only two ways. One which is recommended is to sit with them and try to calm them down by bringing some activity or talking or watching movie or something like that. That is recommended thing. Second thing is medications, antipsychotics. But antipsychotics decrease the quantity of your life, the life expectancy.
I mean, like in the moment when it's happening, I mean, what do you?
I mean, you talk to them and distract them and things like that. Second thing is medications.
So are you taking patients or do you have to be referred to get in?
No, I am taking patients. Yeah, I am taking patients. My number, if you want, you can write it down.
I've already got it, thank you.
You got it? You
Okay, since we're on this subject, my mother goes to a doctor in your practice. And, of course, I've been following you for a while, and I know you have a lot of experience with the older patients. And I was telling my mother about you, and she's having all these side effects and all these problems, and she's not happy where she's at. But there's a sign on your window.
We don't change the doctors in our office. It doesn't look professional.
So what do you do when there's a patient that's not happy with the doctor they've got, and they want to see someone else like you?
I understand, but it is very, I mean, like we are of course colleagues, but we are friends too. It doesn't look professional to see somebody else's. In our office, it doesn't,
Shouldn't that be up to the patient?
I agree with that also, but it doesn't look good. Like it creates bad taste in mouth amongst the doctors. Very few patients want to change. I mean, not very few, but there are patients who don't like me, but they are tolerating me for 10 years.
So can we get your phone number? You just stuck it in. I'm not
You-
giving it to her, I had to look it up.
You can write 270-685-8224. Don't ask the fax number because I'd never remember it.
That's okay, that's all I needed to know.
So Encompass Health brought all the pizza and bread